Hello everyone, today we're going to be talking about the benefits of buffered anesthetic. So before we get started, we're going to go through what they are. Number one, there's less injection pain or steam for the patient due to your reducing the acidity of the solution. Number two, there's also less inflammation or less tissue damage due to reduced acidity. Also, there is a faster onset from 5 minutes to about 1.5 minutes, and it is more effective in the presence of infection. Now, in order to buffer your anesthetic, you're going to need a bottle of sodium bicarbonate. Get a close-up of that at 8.4%, and you will also need an insulin syringe. And we'll be using a 50-unit insulin syringe today, which is 1/2 millimeter or 1/2 cc, along with a 1/2 inch tip. It's important to get the 1/2 inch. Most of them are shorter than that. So today we're going to be showing you how to buffer lidocaine, or red stripe, and articaine, or septicaine, or gold stripe. Now the first thing you're going to do is you're going to need to remove some of the anesthetic from the carpule. So we're going to place it in, and this will be the needle you're going to use on your patient. And you really just want to get the needle in there, just maybe a couple of twists. You don't want to lock it all the way down. And then expel down to the outboard edge of the red stripe. And lidocaine, I want to mention, is a 2% solution. It's important to know what percent solution you're using, because that's going to tell you how much sodium bicarb to add. So now we're going to get our sodium bicarbonate. We're going to make sure we're cleaning off the tip of it. I've got an alcohol wipe here, or Birex, or any disinfectant will work. And we're going to withdraw 25 units, or 1/4 of a milliliter. So we'll put 25 units of air in the syringe, inject. When you're withdrawing from a vial, you're going to inject air and then pull back out the same amount so you don't create any vacuum inside the vial. 25 units. Now the importance of the 1/2 inch tip is that it's long enough to actually make it into your anesthetic carpule, and you'll see as we inject, we're going to be pushing the plunger back on the carpule. Now you have a buffered solution. You will replace the tip of your needle, and of course screw that all the way down, and you're ready to inject. Now the only difference with lidocaine and septicaine, or articaine as the generic name is, is that this is a 4% solution, so you're actually going to use twice as much buffering agent. So again, just maybe a twist or two to get that sort of locked on, and we're going to expel twice as much down to the tooth. On this brand is about where we need to be at. And we're going to draw 50 units on our insulin syringe. Again, and again, a 1/2 inch tip is just the perfect length to actually make it into the carpule. We're going to expel into the carpule. It's much easier to push solution than it is to try to pull solution. And we have our buffered articaine. We're ready for injection. Thank you very much.